Hi guys! Before we start learning with this new topic, subscribe po muna kayo and don't forget to click that bell button para laging updated sa mga latest kaganapan dito sa ating channel. Comment na rin kayo if you have requests or questions. Happy learning! Okay, so good day. So hi guys, sorry at ngayon lang na upload itong aking rationalization sa RadSci natin. So I hope umabot pa sa review ninyo in preparation for your board exam. So wag na tayong paligoy-ligoy pa. So let us start. So first question. So a chest CT scan was performed with the patient couch is moving 20 millimeters per second and the section thickness is 10 millimeters. So, what is the pitch? So, in CT scan, the formula for pitch is equal to couch movement divided by slice thickness. So, in this case, so the couch movement is 20 millimeters per second and the thickness is 10 millimeters. So the pitch is 20 divided by 10, that is letter D. So next, if the pitch for a plain cranial CT scan is 0.75 and the slice thickness is 5 millimeters, so what is the table increment? So the formula for table increment is, so this is the table increment, is equal to pitch times slice thickness or section thickness. So in this case, the pitch is 0.75, then multiplied by 5 millimeters. So that is letter A, 3.75. So next, number 3. So it is a situational question. So a 46-year-old female has recurrent headaches for 2 months. So pabalik-balik yung headaches was temporarily relieved with analgesics. So her daughter noticed that she became forgetful and would be irritable most of the time. A week prior to consult, her headaches became a week prior to her consultation, the headaches became more frequent with associated nausea and vomiting. She also noted gradual weakness in her arms and had difficulty standing up. So the cranial CT scan plain and with contrast and brain MRI was requested and findings reveal gliomas above the tentorium. So glioma is a malignant tumor of the glial tissue of the nervous system, and it is classified according to whether they are above or below the membrane in the brain called the tentorium. Tentorium is a membrane, so the gliomas can either be found above or below the tentorium. So the tentorium separates the cerebrum from the cerebellum. So cerebrum can be found at the upper portion, while the cerebellum is at the lower portion. So number 3, which is true regarding cranial CT scan for glioma. So the answer for that is glioma in CT scan appears hyperdense. So it is brighter compared to the surrounding brain or to surrounding parts of the brain. Number 4, what imaging modality will best demonstrate supratentorial tumor? So of course, it is a soft tissue imaging, so it is MRI. Number 5, appearance of gliomas in cranial CT, MRI with contrast. So it is 1, 3, and 4. So it is hypointense on T1, hyperintense on proton density weighted T2, and hyperintense on T2 density weighted. Okay, so 1, 3, and 4. Hypointense on T1, hyperintense sa proton density, and as well as a T2 density weighted. So 1, 3, and 4, that is the appearance of glioma in MRI with contrast. So I would just like to add this one. So this is the appearance of hemorrhage in MRI. So the appearance of hemorrhage in MRI depends on the timing. So if it is hyperacute hemorrhage, so this means that it occurred less than 12 hours. So in T1 weighted image sa MRI, it is iso intense. In T2, it is hyper or bright. Okay, so let's use the term bright here para mas madaling matandaan. For acute hemorrhage, which appeared between 12 hours to 2 days, so T1, iso intense pa din, but in T2, it appears dark. Sa early subacute, so it appears 2 days up to 7 days. So bright sa T1 and then sa T2 is still dark. Late subacute, so when the hemorrhage occurred from 1 week up to 2 months, so the appearance both in T1 and T2 is bright. And for chronic hemorrhage, which occurs more than 2 months, so the appearance of hemorrhage in T1 and T2 is both dark. Okay, so iso-intense meaning the same ang brightness niya, the same ang appearance niya when compared to the surrounding structures. Okay, so we have here it, B, E, D, B, D, baby, do, do. So let's just memorize the first letters. So this is T1, T2, T1, T2, and so on. Okay, I hope you get the picture. So in T1, so basta magkakasunod lang ito. So T1 iso-intense, then sa T2 this is bright. And then sa T1 iso-intense, ito, then T2 dark. Okay, so this is for T1, this is for T2. Then bright, ito, bright, dark, bright, bright, ito siya, bright, bright, and then dark, dark. Okay? So, meron pang actually isa. So, I bleed, I die, bleed, die, bleed, bleed, die, die. Okay? So, depende kung anong mas easy para sa inyo na i-memorize. So, it be, ed, bd, baby, dudu, or I bleed, I die, bleed, bleed, I bleed, I die, bleed, die, bleed, bleed, die, die. Okay? So, yun yung appearance ng ating hemorrhage. Depende sa timing, kung kailan siya nag-occur, and then depende kung T1 siya or T2. Okay? So, I bleed, I die, bleed, die, bleed, bleed, die, die. Okay? So, I hope makatulong yan sa pag-aaral nyo sa MRI ng appearance ng hemorrhage. So, actually, na lumabas na rin ito ng mga previous board exams. So, sana lumabas ulit. So, para may sure ball na score. Okay, number 6. Okay, for number 6, so cranial CT, appearance of glioma is hyperdense. Okay, so hyperdense, if we are talking about we are describing the images in CT scan, and hyper intense if we are talking about images in MRI. Okay, so CT is isodense, hyperdense, hypodense. Pag MRI, isointense, hyperintense, hypointense. Okay, number 7. So what MRI would distinguish enhancing tumor from non-enhancing edema? Okay, T1. So T1 to distinguish enhancing tumor from non-enhancing edema. So T1. Number 8. So a patient was involved in a motorcycle vehicular accident, was brought to the emergency department. The patient has 9 episodes of vomiting and suffered loss of consciousness. So there is a lacerated wound in the left side of the skull. And CT scan was performed, revealing depressed fracture in the left parieto-temporal area. So question number 8, which of the following is true regarding CT cranial protocol for trauma patients? So the correct answer is letter C. So images are acquired in direct axial and coronal scanning while patient is in his lateral position, which is supine. And also the use of sharp filter for bone to increase spatial resolution. So these are the correct answer. So this is wrong. Okay. So number 9, acquisition for the scanogram for cranial CT scan is achieved in what view? So lateral. So scanogram for cranial CT is nakalateral yung patient. Number 10, so which of the following regarding window setting for cranial CT scan for trauma is correct? So the correct answer is letter B. Narrow brain window width and higher window center. So in order to present small shades of gray and bright center. So letter B is the correct answer. 11. Other term for depressed fracture in the skull is also letter B. So that is a ping pong fracture. Number 12, what artifact is commonly seen in performing scanning for the cranial base? So that is the beam hardening. So that is the most common artifact seen when we perform cranial base CT scan. Okay, so beam hardening artifact. So 13, which of the following is true about first generation CT scan? So the correct answer is 1, 2, 4, and 5. So these are true about the first generation. Number 3 is wrong because the matrix size of the first generation is about 80 by 80 matrix size. 14, the following are characteristics of second gen CT scan except, so A, this is in third gen. 15, in CT scan, which setting should the rad tech adjust to provide better contrast resolution? So to obtain better contrast resolution, so we increase the field of view. So as the FOV increases, the pixel also increases, as well as the number of X-rays passing through each pixel increases. So if we want a better contrast resolution, so we increase the FOV. But if we want a better spatial resolution, so we increase the matrix size. So 16, which factor should the rad tech increase to produce better spatial resolution in CT scan? So I have mentioned that is matrix size. So for spatial resolution, matrix size. For contrast resolution, increase the FOV. 17, the use of small slice thickness in CT scan will, so the correct answer is 1 and 4. Increase spatial resolution and decrease contrast resolution. So if you are going to use small slice thickness, so it will result to increase spatial resolution but decrease contrast resolution. Section 3, cranial CT is the most commonly performed exam in the hospital. Hospital 1 protocol for cranial is to use 25 cm FOV and 512 by 512 matrix size, while Hospital 2 employs 28 cm FOV with the same matrix size, 512 by 512, and Hospital 3 utilizes 20 cm FOV and the matrix size is 1024 by 1024. So also all hospitals are using for their protocol 5 millimeter slice thickness. So what is the pixel size for hospital 1 in performing their cranial CT scan? So the formula for pixel size, so pixel size is equal to FOV divided by the matrix size. So we are talking about the pixel size for hospital 1. So the FOV here is 25. Let's write it here, 25 cm. So we should convert it into millimeter. So it is about 250 millimeter. And the matrix size is 512. So 250 divided by 512 is about 0.49 mm, or that is about zero point 0.5. So this is the correct answer. So remember, if we are calculating for the pixel size, so normally we expressed it in millimeters. So kung naka-centimeter yung given, so we should convert it into millimeter first before we calculate. So next, we're going to compute for the voxel size of the hospital 3. So voxel size is equal to pixel size times slice thickness. Okay? So in hospital 3, so the given is FOV of 20. So the FOV is 20 centimeters and the matrix size is 1024 by 1024. So here, so ang given again, 20 cm FOV, matrix size is 1024 by 1024 matrix size. So we should compute first for the pixel size. So if you can still remember, pixel size is equal to FOV divided by matrix size. So the FOV is 20 centimeters, so that is about 200 millimeter. So 200 millimeter divided by 1024, so that is about 0.195, or if you're going to round it off, it's about 0.2. So the pixel size is 0.2 times the slice thickness, which is, as given here, the slice thickness is 5 millimeters. So times 5 millimeters. So 0.2 times 5, that is 1. So since we are talking about the volume, kasi di ba yung voxel is volume element, so cubic. So cubic millimeter. So I will not discuss bakit naging ganyan yung kanyang unit. So importante is you know how to compute for the voxel size, pixel size. 20, in terms of field of view, which hospital will provide an image that has the best spatial resolution? So number 20, in terms of FOV, which hospital will provide an image that has the best spatial resolution? So I mentioned kanina, if you want a better contrast resolution, so we increase the FOV. If we want a better spatial resolution, we decrease the FOV and instead increase the matrix size. So, hanapin natin ngayon kung saan yung may pinakamaliit na FOV. So, here's the given. So, we have here 25, 28, and 20. So, hospital 3 has the better better or the best spatial resolution. 21, which of the following statement will improve spatial resolution? So, spatial resolution. So, decrease the matrix size. This is wrong kasi as I have mentioned, we should increase the matrix size if we want a better spatial resolution. So, lahat ng may 1, mali na. So, mali na ito, and ito. So, therefore, ito na lang yung natitira. So, siya yung tamang sagot. 22, what parameter should the RadTech use to provide better spatial resolution? So, ito again, increase matrix size. Okay? So, ito siya. So, kailangan lang tandaan nyo yan. Tandaan nyo ito. So, pag contrast resolution, increased FOV. Pag spatial resolution, decrease yung FOV and increase yung matrix size. So, matrix size, and pixel size are inversely proportional. So therefore, ibig sabihin, inversely proportional ang matrix size at pixel size. So if you want a better spatial resolution, the pixel size should also be decreased. Next, 23. So which of the following parameters should the CT scan tech use to improve high contrast resolution? So the correct answer is to use smaller detectors. 24. Which of the following are true in image characteristics in CT scan? So the correct answer is letter C. So 1 and 3 only. So the value of pixel determines the pixel brightness. That is correct. And FOV and pixel size is directly proportional. Okay? So if we increase the FOV, the pixel size will also increase. And in addition, yung sinabi ko kanina, matrix size is inversely proportional to pixel size. So if we increase the matrix size, pixel size will decrease. So ibig sabihin, kapag malalaki yung sizes ng ating pixel, so malaki rin yung ating field of view, pero poor ang ating spatial resolution, pero maganda naman yung ating contrast resolution. So, dito na ulit papasok yung ating image production and characteristics, yung ating image evaluation, yung about sa mga relationships. 25. In performing cranial CT, which of the following are true? So 25, the correct answer is 1, 3, and 4. So 1, 3, and 4. So image plane, sa number 2, this is wrong. Image plane should be perpendicular to OML. So actually, before pa yan. So yung ginagawa nila before, when performing cranial CT, the central ray is perpendicular to OML. Pero for more recent practices, so it is now perpendicular sa GML, hindi na sa OML. So ang purpose nito, kung bakit nasa GML na or sa glabellomeatal line or sa supraorbital or orbitomeatal line is to reduce exposure to the lens of the eye. So for radiation protection purposes. So 26, so situational. So based on the given situation, which is true regarding the MRI protocol for cranial procedure or cranial examination. So the correct answer is letter C. So this is true. So dapat nakasupine yung patient. Ito mali din. So dapat short yung ating TR and short TE. So TR is time of repetition and TE is time of echo. So correct answer is letter C. 27, which of the following will represent MRI images of the brain? So the correct answer is only 2 and 3. So edema will appear bright and T2 weighted images, and also bone will appear dark both on T1 and T2 images. So CSF will not appear bright. It will appear black or dark because it sends no or very little signal. It is void of signal in P1 kaya hindi siya bright. Okay? So mali ang number 1. 28, which statements will correctly describe stroke and MRI images? So the correct answer is letter D. So T1 weighted, so dark siya ang stroke. T through, T. So number 3, stroke will result in the appearance of edema. Okay? So this is false ang number 1. So correct answer is only 2, and 3. 29. The following statements are true in MRI of the brain except D. So, gray matter has less water concentration than white matter. So, ito yung explanation. Nasama na. So, this is false. So, 30, which of the following routine protocols are used for imaging the brain? So, the correct answer is B. Eggshell, T1 and T2 images for MRI. For MRI imaging yan na. T2 coronal cuts and real T2 images are performed using long TE or long time of echo and time of repetition. So, this one is wrong because it should be coronal and sagittal for cella region. So, dapat coronal and sagittal, not coronal and eggshell. 31 types of voltages applied into the ultrasound transducer. So, correct answer is 1 and 3. Burst and pulse voltages. So when we say burst voltage, it measures the system for high resolution contact resistance test. So it is in a form of parang semiconductor siya. So 1 and 3 is the correct answer. 32, in the MRI of the spine, the rad tech must perform B, 1 and 3 only. So, coronal cuts, this is false. It should be eggshell. So, eggshell cut should be obtained parallel to disc space. So, dapat eggshell. So, the correct answer is 1 and 3 only. 33, what should the MRI tech perform for patients with metastatic disease? So, it should be letter B. He should perform T1 weighted images first before introducing contrast media. So the purpose of this is to evaluate the anatomy first before introduction of the contrast media. Okay? So usually kasi T1 for anatomy and T2 for pathology. 34, this classic symptom is called heartburn. So, based yan sa ating uh, situational kanina. 35, the clinical impression for this patient, so situational pa rin yan based on kanina sa binigay natin. So, the clinical impression is gastroesophageal reflux disease. So, di ba usually you will hear heartburn, so that is reflux or GERD. 36, so a large piezoelectric crystal. So PEC is piezoelectric crystals. Increases the size of what segment of the ultrasound beam. So it increases the near field zone. So one only. So kapag malaki yung ating piezoelectric crystal or yung ating PCT crystals, it also increases the Fresnel zone or the near field zone. So far field and Fraunhofer are the same. 36, the most common complication of gastric ulcer is D. Most common complication ng gastric ulcer is hemorrhage. 37, modality of choice for detecting early sign of gastroesophageal disease is nuclear medicine. So for early detection. 38, Curie temperature is described as materials losing polarity at a certain temperature value. So this is very important in our ultrasound. So when the piezoelectric crystals will reach its Curie temperature, it will render it useless. Hindi mo na magagamit yung ultrasound probe mo, transducer mo, because the crystals, the PCT crystals has lost its polarity. So what you're going to do is to buy a new one. New transducer. 39, angle of divergence is identified at letter A. So this is 1 na. 1, 2, and 3. So sa Fraunhofer siya or the far field. So the near field, ito yung near field or yung ating Fresnel, wala na ito. Fresnel zone is convergent or convergence. Yung Fraunhofer or far field, so this is the divergent zone. Focal zone is at the center between the Fresnel and the Fraunhofer. 40, once the sound wave has been generated, it continues in its original direction until it is either reflected or refracted. So kasi kapag na-absorb siya, so hindi na siya babalik sa kanyang original direction because wala nang babalik. Na-absorb na siya. 41. Identified with measurement from the surface of the PEC. So na-mention ko na kanina yung ating Fresnel zone. 42. Constructive and destructive wave interference are confined at divergent zone sa far field. So yung mga interference kaya divergent na siya, yung mga interference and constructive and destructive wave interference. So nag-occur na siya sa may far field zone. 43, the piezoelectric crystal diameter is inversely proportional to frequency. So this means the higher the frequency, the smaller the crystals. Okay? So higher frequency, small crystals. Small crystal diameters or smaller crystal size and vice versa. 45, ultrasound beam focusing classification except longitudinal. So it is not classified as beam focusing technique because when we talk about longitudinal, it refers to the direction. So it is not a beam focusing classification, but it describes the direction of the sound waves or the beam. 46. Refers to speed that the data has been acquired. So it refers to the temporal resolution. So it refers to the precision of a measurement with respect to time, kung gaano siya kabilis. So that is temporal resolution. 47, what CT artifact is also known as capping artifact. So it is beam hardening. So ito yung kanya na nabanggit natin, the most common artifact sa cranial CT. So beam hardening artifact appears as capping artifact. What determines the number of Hounsfield units represented as shades of gray on an image? So it refers to the window width. So number of Hounsfield units, so sa window width. So CT scan niya na. 49, what determines, basta mali yung question, mali yung construction ng question. Which Hounsfield values are displayed as shades of gray? So, which of the following determines the selection where the Hounsfield values are displayed as shades of gray? So, that is window level. So, ito, number of Hounsfield units as shades of gray window width. Ito selects which Hounsfield values. So, window level. So, 50, what is the principal reconstruction algorithm used in CT scan? So, that is filtered back projection. Okay?